If you are trying to treat your own BPPV at home or you're having someone help treat you, I want to just explain how stiffness and tightness in your neck could actually be blocking your effectiveness to treat the BPPV. My name is Luke Gordon. I'm a physical therapist and I treat BPPV all the time with clients at the clinic, and I see this happening quite a bit. Where there's limitations with neck mobility, and that really impacts my ability to do the Epley maneuver effectively. So if you're watching this video, you probably already know what BPPV is, but it's benign paroxysmal positional vertigo. So we're talking about those little crystals that can get loose inside your inner ear canals, those semicircular canals, and causing positional vertigo, where you feel like either you're moving and spinning or that the world is moving around you, especially with certain movements like tipping your head forward and back or getting up and down from bed. So if that sounds like you and you've been trying to treat yourself with the Epley maneuver, I just again want to explain how this neck issue could be getting in your way and what you can do about that. So if you look at the Epley maneuver, and you've tried it before, so you're familiar with it. Hopefully you are, so you know what I'm talking about in this video. So let's say you're treating your right side posterior canal. So you're turning your head to the right, 45 degrees, and you're tipping your head back. And then you're trying to fall backwards, or not fall backwards, but lay backwards. And you're hoping to end up basically with your head still turned 45 degrees to the right, but also tipped back about 10 to 20 degrees in relationship to horizontal, so in relationship to gravity. The common thing that I see, and especially since I treat a lot of older adults with BPPV, is that they just can't get their neck all the way back. That, or they can't maintain a 45-degree rotation and extend their neck at the same time because their neck is so painful and arthritic and just restricted overall. So if you notice that, or let's say you've been trying the Epley maneuver and you just can't quite get it. You've been doing it repeatedly, but then with repeated testing, you still have the sensation of vertigo, and you still have potentially some of that visual nystagmus where your eyes are kind of flicking like that, or rotating, excuse me, then this could be part of it. So what can you do then if that's the issue? I think I have two good options for you, and actually another option, but specifically if you're trying to treat this on your own, because the easiest option is to find a therapist who has a tilt table, so they don't have to address your neck stiffness. They can actually just tilt the entire table. But for most folks watching this video, I'm guessing you don't have that as an option, although you can certainly search for one in your area. But two options you can do on your own then. The first one is just really try to get some help and work on your neck mobility. So work on stretching your neck, work on seeing a physical therapist, massage therapist, chiropractor, all of the above, whatever you can do to get some more mobility out of your neck, because if you can rotate your neck more easily and you can extend more easily, so you get more mobility there, you'll have an easier time treating yourself with the Epley maneuver. Specifically, when we look at that, again, that first position where you're just trying to get into position, and then you're trying to go from from first to second, where you have to rotate your head while keeping it extended. So again, if you can't make that bridge from first position to second position, you're just not going to move those crystals. So that's your first option then, is get some help, work on your mobility. Obviously there's stretches and exercises and things you can do like that. I'll link at the end, or even right here, some like self-massage techniques where if you just work on some of those restricted muscles, that can help as well. But really when I think of the restrictions, it's a lot of just joint restriction. You just can't get your neck back in that position. So do what you can there, get some help if you need to. And then the other thing you can do, which I do a lot in the clinic, is and I don't have a tilt table either, which I should, but I don't, but I'll just use a lot of pillows underneath the person's mid-back to kind of prop them. So that way when they do end up on their back in that first position, their mid-back, they're kind of already got a little bit of a decline because I put several pillows behind their mid-back. So that helps too. So that's your second option. Is just so try those two things, again, because a stiff neck can really block your ability to do the Epley, which is how you're going to treat that most common variant of BPPV, which is the posterior canal variant. So there you go. I hope that helps. I'll make another video soon too about cervicogenic dizziness and vertigo, which basically means that some of your symptoms could actually be coming from your neck. So usually when I'm treating people for vertigo, I always check their neck because they could have symptoms that are overlapping, and a lot of times they just have stiff necks anyways, and who doesn't want to feel a little bit more, loose in their neck and potentially have less headaches as well. So I'll make some more on that soon here. If you have any comments, I'd love to hear from you below. If you've had issues treating with the Epley and you figured out ways around it, or you figured out ways to improve your neck, I'm sure people would love to hear that too. So there you go. Thanks for watching, and I hope that helps you treat your BPPV. Talk to you again soon.